BRCA1 and BRCA2 are important for our patients to know about, both for their own health and for their families. Our patients may alter their decisions about local therapies. They may alter their decisions about proceeding breast-conserving surgery or with bilateral mastectomy. Even those patients who may choose breast-conserving surgery may opt for more enhanced screening, with screening MRIs or more frequent mammography. We would also strongly recommend oophorectomy for our patients at the time that they've completed childbearing, because that both decreases their risk of ovary cancer and decreases their risk of a new breast cancer for women who've elected to maintain their breast tissue intact. But I think even more importantly than for our patients who've already had a malignancy is the information this gives to their family members. Quite simply, knowledge is power. This gives the women and the men in their family who may have inherited this abnormality the potential to consider testing, to consider prophylactic surgery, prophylactic medications, enhanced screening. It gives them the possibility to envision a very different future for themselves, a future that has a much lower likelihood of including cancer as part of their personal health history. Unfortunately, we know that testing in the community is dramatically underutilized. So the most recent demonstration of that actually came from a clinical trial that I've conducted with my colleagues at Indiana University and joined by about 24 centers around the country. The trial didn't have as its purpose to study genetic testing. The trial was looking at a therapy in women who had triple-negative breast cancer or known BRCA mutations, who had had neoadjuvant chemotherapy and had substantial residual disease at the time of surgery. Our therapeutic question was quite simply driven by the knowledge that these are patients who have a very high risk of recurrence, and therefore a fruitful avenue for research to look at moving novel agents into the early stage setting much sooner than we might otherwise do. As part of the data from that trial, we asked all of the patients and their treating physicians if this was a patient known to have a BRCA mutation. The trial enrolled a total of 135 patients, of whom 6 who entered the trial were known to have a BRCA mutation. As part of the consent for the trial, we collected genomic DNA. We told patients that it would be subjected to a variety of genetic tests and that they would not be given the results of those tests. They were for research purposes only. We had adequate genomic DNA in about 101 of those patients. That happened to include all 6 who were known to have a BRCA mutation. We sent those samples to Dr. Mary Claire King's laboratory at the University of Washington for BRCA analysis, which is a larger panel looking for genomic germline mutations that are known to increase the risk of breast cancer that includes BRCA1 and BRCA2 amongst a bunch of others. Mary Claire's laboratory tested those 101 samples and she found BRCA mutations in 20 of those patients. Now recall that only 6 had been identified as part of routine clinical testing. So only 30% of the patients who entered this trial with a BRCA mutation knew that they had that mutation. Now this was a group of patients, over half of whom should have been recommended to have genetic testing just on the basis of age and disease phenotype alone. Their median age was 48. They all had triple-negative disease, so over half of them should have been offered testing. Unfortunately, our data doesn't allow us to determine of those who did not know they had a BRCA mutation. Had they been offered testing, or was it never offered? Had they been offered testing and the patient declined? Or were there financial limitations, that this is still expensive testing that is in some cases not covered by insurance, not covered by Medicare, even for patients in whom the guidelines would recommend therapy. So we could certainly conclude that testing is dramatically underutilized. Our data just doesn't let us determine why it was so dramatically underutilized.